A woman schedules a visit with the clinic to talk about the resources available to care for her elderly mother, who has terminal cancer and has had multiple strokes. What kind of recommendation or consultation would be appropriate for this client? A. Oncologist. B. Speech therapist. C. Social services. D. Hospice. A 12-year-old boy cracked ribs 7 and 8 on the left side in a bicycle motor vehicle collision. The sight of these injuries raises the possibility of A. Renal trauma. B. Tracheal or bronchial injury. C. Pneumothorax or hemothorax. D. Hepatic trauma. The NP reports that one nurse on the team frequently avoids caring for elderly patients and occasionally speaks poorly about the elderly. The NP should respond in the following manner to A. Avoid assigning the nurse to older patients. B. File a complaint against the nurse. C. Advise the nurse that ageism is inappropriate. D. Discuss attitudes toward aging with the nurse. Before beginning, the nurse practitioner informs the client of the plan and gets their approval. She might go over different alternatives for treatment. Which phrase best sums up the nurse's goals for the patient? A. To legally cover the basics to prevent a lawsuit later. B. The practitioner is following the facility's policy. C. Providing enough information so the client can make an informed decision. D. To stall for time as he or she silently assesses the client. A 12-year-old cystic fibrosis patient's parents admitted negligence in completing chest physical therapy, follow-up appointments, and monitoring nutrition and medical care, resulting in potential outcomes for the patient and family. A. Occupational therapist. B. Respiratory therapist. C. Social worker. D. Case manager. The NP aims to deploy a new technique in the provision of patient care, cognizant that the main obstacles to change are typically A. Lack of adequate preparation. B. Poor change design. C. Insufficient supporting data. D. Staff resistance. Which communication rule does the nurse practitioner comprehend while speaking with coworkers and other patients? A. Conflict should be dealt with honestly and openly with all team members. B. Understand that conflict resolution is an ongoing process within an interdisciplinary team in an office care setting. C. All of the above. When a child is being treated for refractory epilepsy with a strict ketogenic diet, the following should be present in the diet. A. High carbohydrate, high fat, and low protein. B. Low carbohydrate, adequate protein, and high fat. C. Low carbohydrate, high protein, and low fat. D. High carbohydrate, low fat, and adequate protein. The NP is concerned that a stroke victim with chronic dysphagia and a coughing fit might aspirate. Which of the following recommendations is ideal? A. Occupational therapist. B. speech pathologist. C. Physical therapist. D. Respiratory therapist. A young woman and her toddler are under the care of the nurse practitioner. Which of the following best illustrates how the nurse practitioner's job description includes primary prevention? A. The practitioner documents the current immunization status of the child. B. The practitioner performs the assessment on both the mother and the child. C. The practitioner discusses seat belt safety with the mother and offers to show her the proper use of car seat restraints. A male patient, age 6, who is highly active and frequently disturbs the pediatric unit by banging on the bed, calling out, tearing things apart, and causing commotion. The ideal answer is probably A. Reward the child with a treat for good behavior. B. Admonish the child to behave better. C. Plan regular periods of active play throughout the day. D. Keep the room quiet and lights dimmed. Which of the following medical services can a teenager under the age of 18 receive or reject without their parents' knowledge or permission in the majority of states? A. Chemotherapy. B. Emergency contraception. C. Transfusions. D. Abortion. An adult patient is being informed about asthma treatments by the nurse practitioner. Which administration sequence would be most suitable? A. Tobramycin, Intal, albuterol. B. Intal, tobramycin, albuterol. C. Flovent, Intal, tobramycin. D. Albuterol, Flovent, tobramycin. The pediatric nurse should hold and move a piece of yarn when conducting the Denver 2 assessment of the child's capacity to follow an object with the eyes to and past midline. A. 8 inches above the child's face. B. 18 inches above the child's face. C. 4 inches above the child's face. D. 12 inches above the child's face. The following factors put patients who use urinary catheters for an extended period of time at risk for acquiring resistant infections. A. Trauma related to catheter movement. B. Blockage of urinary catheters. C. Development of biofilms in the bladder. D. Development of bladder ulcerations. Which of the following actions demonstrates cultural competence on the part of the nurse practitioner? A. Stereotyping patients based on their culture to make sure that you know how to treat them. B. Using the same communication styles across all cultures so to not be perceived as bias. C. Using eye contact to show respect and listening. D. Identifying and avoiding gestures that groups or cultures may find offensive. Which of the following situations is most likely to present a challenge for a child seeking medical attention? A. Lacking an extended family. B. Having a single parent. C. Living in a rural area. D. Being homeless. A patient has septic knee arthritis. Antibiotics are a part of immediate care together with A. Cold compresses. B. Nonsteroidal anti-inflammatory drugs. C. Drainage of the joint. D. Hot compresses. When a pediatric nurse conducts continuing nursing education on child safety and fall prevention for other nurses, she is acting in the capacity of A. Mentor. B. Clinical content expert. C. Preceptor. D. Change agent. A patient with a T6 spinal cord injury lays flat on their back in bed when all of a sudden, they have blurred vision, a terrible headache, a piloerection with pallor below the lesion and flushing above it, as well as noticeably raised blood pressure of 280/160. The first thing to do is A. Check bowels. B. Elevate the head of the bed to 45 degrees. C. Check bladder. D. Loosen clothes. A patient is requested to make quick, alternating hand movements by the family nurse practitioner to assess A. Cerebellar functioning. B. Cognitive functioning. C. Reflex arc functioning. D. Stereognostic functioning. The family nurse practitioner finds that a patient aged 2.5 has a lead level of 16 micrograms DL and A. Advises the parent to avoid giving the patient bottles of whole milk. B. Consults with a physical therapist for muscle strengthening. C. Orders an increase of iron supplements to 6 mg/kg per day divided in 2 doses. D. Repeats a blood test within 1 week to 1 month. Vietnamese patient, age 38, informs the family nurse practitioner that their parent passed away from liver cancer when they were in their 40s. According to the nurse practitioner's assessment, the patient is vulnerable to A. Hepatitis B. B. Malaria. C. Tularemia. D. Tyrosinemia. A generalized, non-pruritic skin eruption has periodically worsened in a 40-year-old patient over the past 10 years. Over the patient's left gluteal fold, a well-circumscribed erythematous plaque has recently developed. The lesion is scale and fissure covered. The family nurse practitioner diagnoses one of the following: A. Atopic dermatitis. B. Ichthyosis. C. Psoriasis. Determining occupational exposure to disease is difficult because of A. Confidentiality of the information within company records. B. Inaccuracy of occupational disease reporting. C. Long latency period between exposure and disease development. D. Reliance on workers' memories. A patient who underwent a total gastrectomy a year ago reports experiencing tingling in the lower extremities, indigestion, and a sore mouth. Which test is recommended by the family nurse practitioner? A. Blood urea nitrogen level. B. Complete blood count. C. Liver function study. D. Thyroid function study. Epistaxis, dilated pupils, tachycardia, and mild euphoria are present in a 42-year-old patient who also uses A. Alprazolam, B. Cocaine, C. Morphine sulfate, D. Oxycodone hydrochloride. A faint first heart sound with a holosystolic apical murmur that radiates to the left axilla during cardiac auscultation indicates A. Aortic stenosis, B. Mitral regurgitation, C. Mitral stenosis, D. Mitral valve prolapse. A myocardial infarction patient who needs more atorvastatin calcium visits the clinic. The family nurse practitioner is aware of the conditions for which the drug is prescribed. A. Cancer prevention, B. Primary prevention, C. Secondary prevention, D. Tertiary prevention. A strawberry hemangioma measuring 2 centimeters in diameter is present on the left buttock of a 2-month-old patient. The family nurse practitioner says the following to the patient's parents. A. Advises that the lesion should spontaneously resolve. B. Asks about any history of gestational diabetes. C. Investigates any family history of skin disorders. D. Refers the patient to a dermatologist. Clinical practice recommendations are intended to A. Increase variations in clinical care, B. Mandate practice decisions, C. Protect nurses from legal liability, D. Serve as a handbook for best practice. The family nurse practitioner takes part in a quality improvement initiative run by a hospital. To make sure diabetes protocols are followed, the nurse practitioner reviews 4 of a colleague's charts each month. This method is A. Core competency, B. Force field analysis, C. Peer review, D. Risk analysis. Which medication is linked to higher levels of lipoprotein? A. Furosemide, B. Hydrochlorothiazide, C. Spironolactone, D. Triamterene. Chinese 55-year-old patient with father attends follow-up appointment. How can a family nurse practitioner provide care that is sensitive to cultural differences? A. Consult patient's father for questions about son's care. B. Asks the patient's father to leave the room due to confidentiality issues. C. Performs the examination without speaking to the patient's father. Family nurse practitioner investigates chlamydia diagnoses in rural community, suspecting patient's inability to inform partners, postponing treatment, and conducting research. What kind of hypothesis is being used by the nurse practitioner? A. Complex hypothesis, B. Deductive hypothesis, C. Inductive hypothesis. D. Non-directional hypothesis. Utilizing in the treatment of viral conjunctivitis. A. Antihistamine decongestant drops. B. Cold compresses. C. Hot compresses. D. Steroid eye drops. What is the primary justification for giving progestational medication to estrogen-using perimenopausal women? A. Decrease the risk of endometrial hyperplasia. B. Prevent hot flashes. C. Prevent osteoporosis. D. Promote growth of the uterine lining. The family nursing practitioner displays leadership in the workplace by A. Adding clinical protocols to the nurse practitioner scope of practice. B. Comparing the workplace roles of the registered nurse and the nurse practitioner. C. Creating a task force to address scope of practice concerns. D. Lobbying to eliminate continuing education requirements.